Good afternoon, dear professors, dear colleagues. Permit me to introduce you to our today's talk about using antibiotics on various surgeries with my dear colleague, Dr. Mikhail Shahada. We'll be following this agenda. I will be doing the first half presentation, and Dr. Mikhail will do the remaining. A major health problem in hospitals nowhere is the increasing of antibiotic resistance in patients. In general surgical field, the main or the major factors are prescription of antibiotics for viral infections, the frequent use of broad-spectrum antibiotics, and irrespective of duration and the cause of usage. The selection of antibiotics for usage in preoperative period depends on multiple factors which are the type of infection, the patient allergies, the type of applied surgery. The most commonly used antibiotic in surgery is the first generation cephalosporins and gentamicin. In the case of anaerobic infection, commonly used metronidazole or tinidazole. In the case of staphylococcal susceptibility, commonly used antibiotic is the flucloxacillin or vancomycin. We found a very interesting clinical trial of Turmozoglu and al., which assure our principles. The study was based on 176 patients with various surgical infectious, and the results were as follows. The study applied that the broad-spectrum antibiotics are the most commonly used in surgical practice. And now is the turn of my colleague, Dr. Mikhail.
Thank you, Dr. Ibrahim. It's my pleasure to be with you the second time today in this great conference. So I talk just about the types of surgery according to microorganism. We are classifying the types of surgery according to microorganism: clean surgery, clean contaminated, and contaminated surgery. If we will go for health skin incised for clean surgery, we will not recommend antibiotics, either not the clinicians or the guidelines. If prosthesis, we can recommend antibiotics. If clean contaminated, either respiratory, alimentary, genitourinary tract infections, we can recommend antibiotic. Contaminated surgery as microscopic soiling of operative field, also as example in peritonitis, strongly recommended antibiotics. In all types of surgery, just we measure now the microorganisms and some selective antibiotics for each type. Plastic surgery, for example, we can find in swabs Staphylococcus aureus or Coagulus negative staphylococci, so we can use cefazolin, cefuroxime, sodium, and so. In gastrointestinal surgery and also in gynecological surgery, we can find enteric gram-negative bacteria, anaerobes, intercocci, also group B streptococci, and other anaerobes. We can also use cefoxitin, cefotoxan, cefazolin, ampicillin, and sulbactam. Orthopedic surgery mainly, we can find Staphylococcus aureus and Coagulase negative staphylococci, so we can use cefazolin and cefuroxime sodium and vancomycin. Also in vascular surgery, we can find Staphylococcus aureus, Coagulase negative staphylococci, and enteric gram negative bacilli, so we can use cefazolin and vancomycin. So cefazolin is remaining one from the most important antibiotics in surgeries. Impact of antibiotic misusage, we have two major factors. It's the high treatment cost sometimes and the increasing of mortality rate. So I was very happy to be with you, and in conclusion, the optimization and respect of guidelines internationally and the usage of antibiotic needed to be by priority on every healthcare center, every specialized hospital. The classification, as we mentioned, clean, surgery, clean, contaminated, and contaminated, respectively, provided the improvement of usage of antibiotics and the development of many initiatives, the replacement of an antibiotics by another ones can lead to favorable results. Thanks a million. And those are our references. If you have any question, you can ask us now, or you can just send to us via mail.